My name is Charlene Margot, and I am co-founder of nonprofit The Parent Venture. We are just delighted and honored tonight to have with us Dr. Steve Adelsheim and Dr. Shashank Joshi. Take it away, gentlemen.
Thank you very much, Charlene. I'm going to start and I'm going to share my screen and hope that you can all see this. And I think that I'm supposed to give you a cover slide first. Here, there's the cover slide. So I'm going to speak about, I'm coming to you with a lot of grace and gratitude for this invitation, but also I'm coming to you as a parent. And so thank you, Charlene, for the very kind introduction. But I think probably where I bring the most experience is I'm a parent with lived experience because my wife and I have 3 boys, and one of them has really struggled. And we have learned some things in the process through his experience, through our experience, through listening to parents, engaging with our larger community, in particular, the work with school districts and the ways that schools can promote mental health. But I think for parents, it's really important to understand that you are not alone. When we talk about mental health, we think about it as part of overall health. And our students have to be healthy enough to learn. Our teachers have to be healthy enough themselves and have the tools to engage with each and every one of their students. So part of what we try to do as part of the HERD Alliance, which brings together mental health, primary care, and school leaders, is how do we think about mental health as part of overall health for our students to be healthy enough to learn? And for us as parents, of course, we're concerned about school, but we're also just concerned about their lives. So I'm going to highlight a few things we've learned around some everyday questions that parents may have. Is this normal? Is this not? How do I know when to worry as we deal with these post-COVID times? Of course, we probably will never be rid of COVID, but we're probably through the first pandemic anyway. And there have been some things we've learned along the way. So I'm going to cover these, and then I'm going to invite Steve to talk more about the resources that are available to folks. So stating the obvious, the disruption in the last 3.5 years has really been exceptional and profound. And children's mental health now is in a state of national emergency, and many pediatric groups have declared this. In fact, most of our kids are actually doing pretty well. They bring a lot of strengths, and they bring supports that allow them to get through the toughest times. But, we all go through struggle that's part of growing up. And some questions we get are things like, what is normal? And, when can anxiety actually be helpful to us? Maybe a little stress can really be useful, like before a test or before a big performance, before a game, before I'm going to ask that girl to prom. But a lot of stress for extended amounts of time. We know from a neuroscience perspective, from a lot of work done, some of it at Stanford by our colleague Victor Gadillon, that we release cortisol. Cortisol can interfere with our ability to think clearly, and over time can actually be toxic to the brain. So when do we consider it a disorder? How do we know when to be concerned? And again, from the data we have from the CHIC survey, the California Healthy Kids survey, we know that actually the majority of our kids are doing reasonably well, but a significant minority have struggled in new ways over the last 3.5 years. And so part of what we might talk about today is what are some resources that you all can avail yourselves of as maybe perhaps you're on a waiting list or you're waiting to see the primary care clinician to talk about your concerns. So from our colleague, Sarah Ordaz, she and I did a talk about this for parents a couple of times now. And so there's a few little graphs here. This little character on the left, this is kind of what anxiety looks like, right? This isn't a disorder per se, but if you have more than one of these symptoms for a few days, it really can feel very hard just to get through our days. And so we want to think about if it is excessive and not just a little bit of anxiety and worry that we as parents want to help our kids get through. We don't want to just put out the fire. We want to give them the tools for coping to think about, all right, when my mind starts to think about this and I can't get rid of it, here are some things I've learned. I've learned them in class, or I've learned them by connecting with, a peer who's gone through this, or connecting with a counselor, or maybe even a therapist. But if we see excessive anxiety or worry for more days than most, for at least 6 months, about a lot of different things, which are difficult to control, then we might be dealing with a disorder, anxiety disorder. So in adults, on this list here on the right, 3 out of 6 of these is what we would typically want for a diagnosis. But in children, only 1 is required. So if your kids or your kids' friends are presenting with this for more days than not, for at least 6 months, and it's getting in the way of their functioning, we might be dealing with a disorder, a generalized anxiety disorder. But this list is not meant to diagnose it. It's just to kind of give you a clue. And Charlie Brown reminds us sometimes it's not the anxiety so much as thinking about the anxiety, and that can make things worse. So one of the things we do in talk therapy, and talk therapy, by the way, is the most effective way to treat anxiety. And it is really profoundly life-changing when you can learn these skills, not only as the young people who are struggling, but as parents. There are books out there, which I will highlight a few of, that can teach us the skills as parents to understand what our anxieties might be and what we might be unwittingly transmitting to our kids and modeling, and also how to support them and help them through working through some of the struggles and worries that they might be dealing with. And these are based on the principles of a type of talk therapy called cognitive behavioral therapy. You may have heard about that, also known as CBT. These 2 books on the left in particular are tried and true. Ronald Rapie and Tamar Chansky. We have used these books in my own household, and I'm a firsthand witness to tell you that they can be very effective. These are for kids, what to do when you worry too much, a kid's guide to overcoming anxiety, lots of pictures and some simple strategies. So this is part of a technique we call bibliotherapy, where we might invite a parent to check out a resource, and then before they come to session, we'll have some things to talk about. We might even assign some readings before they come to session. And I put several resources at the end, including the Stanford Parenting Center, which has a number of short videos and a wonderful Instagram page that can really give you some hints in real time about how to manage some everyday worries, and then what to do when you think you might need to take it to a clinician. We are seeing higher rates of depression and anxiety over the last 3.5 years. And we probably don't need to get into the reasons why. There are lots of things to be concerned about. And, how do we deal with the everyday anxiety and then deal with things that are outside the everyday, like what's been happening in the world for the last 2 weeks. And so those who may have struggled with mental health issues now, say, who previously had a diagnosis of anxiety or depression, or who didn't, but may have had some symptoms. And here I have some symptoms of major depressive disorder, and I put the symptoms of anxiety before. All of us will go through some of these symptoms on the slide. But if you have more than 5 for at least 2 weeks in an adult, then we might think, okay, there might be actually a disorder going on here. In the case of children, shorter time period. If we see 5 or more of these symptoms for a week or more that are not getting better, then we may want to consider that our child, this is not drama, this is not attention, this may be depression, a medical illness. Depression lives in the brain, and this does not mean we need to use medications right away to treat it, but it does mean that you can think of it in some ways as a type of mind injury. We think about brain injury, traumatic brain injury. This is like the mind is injured, it needs some healing. And we know, again, that talk therapy can be very effective, especially for mild forms of depression. So we want these conversations to be happening early and often. And we always think about the role of culture because it is crucial. It's everywhere. The intersection of values, beliefs, traditions, and behaviors. We have a very rich cultural milieu in the Bay Area, and the interaction among biological or genetic or family factors with the psychosocial conditions that our kids are facing right now in the face of culture is what can not only lead to depression, but also can prevent depression. So, for example, we learned after the pandemic, some of the things we took for granted, caring neighborhoods, for our kids to know that their ideas are valued in their community. Many of the school boards in the Bay Area have student representatives. If we're going to be by, for, and about students, we need students at the table in order to, even if they're not voting members, to be at the school board meetings to really talk about what the issues are. And so these are things that can really promote well-being in our young people and actually prevent depression. So we think about the interaction of these factors, and we think about brain conditions. And in the interest of time, I won't go through this in detail, but I use this slide just to highlight, if you look at the red pathways here, this is serotonin. Serotonin is very important for mood and anxiety regulation. And if you just look on the lower right side here, serotonin is not only important for memory and mood, is what we might think about, but also for sleep and cognition, all the things our students need to be healthy enough to learn. So I use the brain slide sometimes to convince folks, maybe reluctant folks on school boards, why we need to be thinking about mental health in school environments. So out of the pandemic, if we think about the Chinese symbol for crisis, we have a chaos on this side, we have the opportunity on this side. What are the opportunities? Well, one opportunity is the Greater Good Science Center from UC Berkeley, a trove of resources for parents, for young people. And I first learned about them during the pandemic, and I'm very, very grateful for all the resources that continue to be uploaded there. This is one I've shared before on a talk that I've done with April Torres, who is here as one of our facilitators and leadership in the San Mateo Union High School District. The 6 daily questions for quarantine. And we maybe can get into some of these in the Q&A, but there was an article written by this journalist, Brooke Anderson. It's free and available on the GGSC website, but I actually think that these questions are relevant for all of us now. And I want to call out 2 in particular. So what am I grateful for today is a way that our minds can focus on some of the things that we may take for granted. And there are gratitude exercises that I'm going to highlight in a moment that are scientifically shown to really help our overall mood and emotion, not only for us, but also for our children. And who am I checking in on or connecting with? So in the pandemic at that time, I had maybe 5 people in my life who were 90 plus, and making sure that I checked in with them like once a month and that my kids could talk to them. Now, these were their grandparents or their uncles and aunts or close friends of the family, but that joy in checking in on and hearing some of their stories, it might be 5 or 10 minutes, but it's a really nice way for us to, we are social creatures. And even though we were told to socially distance, I think what people meant was they wanted us to physically distance, but socially connect. So these are important as we make our way through this fall with new COVID and new RSV and flu season, that we want to make sure that socially we stay connected. And this is what we're all doing right now. I want to honor all of you who were on this presentation with us, because this is what you're trying to do. You're trying to keep your battery well charged. You're building your coping capacity to avoid burnout. And so the positive input through healthy activities. Now, again, before the pandemic, we might have taken things for granted. In-person activities like youth sports and theater and just connecting with friends in person, seeing your teacher, being able to have lunch in their classroom without necessarily even talking, just knowing that, Coach Stu, I'm thinking about Los Altos High School, baseball coach, won a championship a few years ago. It's a district we consult with. That coach is a place where students just come hang out in the room because you don't have to say anything. You just go there and chill out. It's a stress-free zone, right? So we want more of that as we manage these negative inputs. So the idea here, this is from Grace Zhanggu, who runs well-being in our department. You can do anything, but you can't do everything. And so you have to do the things that will help build your coping capacity, and that will help as we go forward. I'm going to wrap up here with the last couple of slides. I mentioned, and you'll hopefully be able to access these slides. I think that Charlene and Bev will make these available to you. But this is some science showing you about the importance of gratitude practice and the science behind it. And self-valuation, which is some work that our colleague Mickey Trockle done at Stanford, which is about prioritizing our own well-being, even as we take care of others. It's a little bit of the oxygen mask metaphor, taking care of ourselves so we can be there for others, but also making sure that we can model the growth mindset, right? If we make a mistake, particularly as parents, modeling for our kids, it's not so much what we say or do, it's just what's around us. I mean, in the 9 Bay Area counties, the kids are growing up with success all around them. So, as much as we can tell them, you don't have to go to this college or that college. We want you to find the best fit. There is a certain intrinsic sense of our young people of wanting to meet or exceed our expectations, right? So being able to talk about our own mistakes and how we grow from them is very important. And higher self-valuation and understanding and modeling, hey, I messed that up. The 4 most important words that the Navy SEAL leader does, I screwed that up, and then talking to the team about what they learned from it, that can make a very effective leader. It can make a very effective parent. Higher self-valuation, lower burnout. Lower self-valuation, higher risk for burnout among healthcare professionals. As I said before, we're often kinder to others than to ourselves, knowing that all of our feelings are okay, even if we're very worried about our student or about our child or about to launch young adult. I am not only my feelings, and my mistakes do not define me. If I can learn how to notice and observe my emotions and name them instead of only just feeling them, I actually can activate higher cognitive processes. And in so doing, I can understand and manage things like my anxiety better. Well, that's another kind of tool we can give to our young people. Just being able to come and speak with you about it as parents allows them to feel, and what we have to do is just learn how to not talk, learn how to listen, learn how to actively engage by not talking. You can practice this with your spouse or partner or romantic interest, just listening. One of the hardest things to do, but in survey after survey, that is what our youth want from us. Talk less, listen more. So what are your essential ingredients for resilience? Think about that. We have a bunch of resources here. I want to call out a couple in particular. The National Child Traumatic Stress Network has a lot of wonderful tools. How do we talk to our young children, about to be teens, our tweens, our young adults about what's going on in the world? Lots of nice examples for how to open the door to conversations. Really wonderful resources from the Trevor Project on youth mental health promotion. The Center for Youth Mental Health and Wellbeing, you're going to hear more about when my colleague Steve comes on, helping teens make room for uncomfortable emotions. This comes out of COVID, but is still very, very relevant. Silent signs your child is stressed. It's a New York Times oldie but goodie article. And some other resources here for sleep and other things. So with that, I am going to stop my share and turn it over to my colleague, Dr. Stephen Adelsheim.
Thanks, Dr. Joshi, for your really thoughtful explanations diagnostically, as well as your guidance on how we can all do a better job as parents in terms of taking care of ourselves. I'm going to share my screen and move to the slideshow here as well. So I too am really honored to be with all of you this evening and share a little bit about some of the work we've been involved with. And as Anna shared with you earlier, through her leadership, the Peninsula Healthcare District has taken on this alcove effort, and I'm pleased to share a little bit about that with you. And I'm going to also talk a little bit about some of the guidance from some of our young people related to youth mental health and social media, because they have become guides for us in this area that we're all very concerned about. And then, as Shashank shared, some of the school and community partnership work that we've been involved with. So let's jump into that right now for a second. So if I can, let's see. So just as a reminder, and as Shashank, mentioned in terms of the situation with COVID, being such a difficult one for all of us, the reality was those of us doing this work, and for many of you, as parents, we all knew we were facing a crisis in terms of mental health supports well before this pandemic actually began. And certainly, the numbers here that you see from the Youth Risk Behavior Survey showing these higher rates of young people feeling sad or hopeless or having poor mental health, are somewhat frightening, but not surprising given the situations we had before and the challenges in terms of missing school and the other issues that, we and our families have been facing during this very difficult time. One of the things that maybe you have experienced, that many of us have experienced, not only, on the other end as providers, but also as family members and parents, is the challenges we've all been facing in accessing care for our young people, the lack of a youth behavioral health workforce to be able to provide the support for the young people in our families and our communities. And so it's been really important for us to think about ways of building that out. As Shashank has also mentioned, as we talk with young people, and before we move towards developing this alcove model, we met with young people not only around the peninsula, but across the country to get a sense of what they really saw as some of the key issues around accessing mental health related kinds of support. And I'm sharing, these 6 with you now, but I want to just highlight a couple of them. One that was just really important was the sense that you see in number 3 of the idea of actually asking for and accessing professional help is a huge leap and a big step in terms of going out and getting additional kinds of supports. If you look at what's there as number 5, engaging a young person, engaging in mental health supports often means stepping out against a family's wishes. Many of our families and cultural groups continue to face great stigma around accessing mental health care, this notion that we should be dealing with these issues only within our families. And for young people that want to get other supports in other places, it really is a big challenge and a big risk sometimes to do that without family support. And then as Shashank was referencing earlier in terms of listening, this sense that everybody wants to tell us, young people, what we need to do, but no one is really listening to us. So I would just reinforce his comment, and this is one more study that shared the same thing, that young people are really asking us to listen. And so, I think was shared in our introductions. I worked in school health and school mental health for many years and got to meet Shashank when I was doing that work in New Mexico, and we've continued to collaborate on that work here in the Bay Area as well. I will tell you that, we went out to look for other ways of building support for our young people, other spaces to do the early intervention work that we felt was so necessary and important, and started learning about this model internationally of what's called integrated youth health. And we learned about these programs that are supporting young people very early so that they don't need to wait until things are at a crisis point to come in for care, that create very accessible spaces that are comfortable for young people to come to and really are able to serve everybody. And we learned about these models from international partners. There was the Headspace program in Australia that really has now developed to 150 centers in a country that's half the population of California. Our partners in British Columbia that developed the Foundry model, now at 20, but going up to 30 sites, Jigsaw in Ireland, on other international partners, such as through the leadership of the World Economic Forum that have also supported and guided the expansion of this model. And as we met with young people around the Bay Area and in Santa Clara County, where we were really first looking at getting this going, the young people really chose this name for our programs, All Cove. The sense that all young people can come in for this early care, and a cove as a safe, protective harbor that will be a comfortable place for young people. And you see there where every youth belongs, chooses the support they need, and thrives. And that also came from the voices of our youth in developing that. So what we've really been involved in doing is trying to create and expand on what is this sort of public mental health continuum of early care for young people that really begins with critical school health and mental health related supports, allows for the additional support through an alcove center, and I'll go into the details around that a little bit more, and then also links to early psychosis programs, which have been a large national and state initiative to link young people with early signs of serious mental illness and early signs of psychotic illness to critical early support. And we see these alcove centers as places where young people might feel comfortable if they're having some of those symptoms to come in and get that early care. And then we can make linkages to these critical programs like the Remind program run by the Felton Institute folks in San Mateo, or other programs like this that have taken off really across the United States. These are the core components of alcove centers. For us, linking mental and physical health has been really important because we see also many young people tell us they often feel more comfortable coming in to see a primary care provider for their headache or their stomach ache or what might be, behind or as a response to their anxiety or depressive symptoms. And then maybe after a few visits, they feel more comfortable going and speaking to that mental health provider. It's been important for us to link for supported education and employment so that young people are feeling comfortable in their educational setting or helping them move to the next one, and supporting them in terms of employment and finding careers. Early treatment for substance use is a critical piece as well at alcove centers. And alcove centers are really based on a model of peer support, where young people know they can come in and talk with other young people that have been through similar experiences and be able to link them to additional care and support as well. And then for families, the same thing, to have places where one can get guidance in how to support their young person and learn from other families how to get additional support for these concerns for our youth to get the care they need. Within this model, we really have strong community engagement and partnerships based on a community consortium that guides and supports the services. We have a shared evaluation that all alcove centers are using. We're working with the state on financial sustainability models to expand this service system. And then all the alcove centers have sort of a common look and feel that I'll speak to a little bit more, and a learning community where everyone is sharing what they're learning with each other. And again, all the alcove centers really want to follow all the state laws and federal laws around informed consent and confidentiality to make these places that are comfortable for young people, where they can trust that they're getting support they need and be able to talk to people who can understand the issues that they're facing as well. At the core of the alcove centers is youth and youth voice. And as Shashank was saying, the importance of hearing from our young people is at the core of the alcove centers. And at Peninsula Healthcare, where Anna and the team have been developing the alcove center, they have an active and thriving youth advisory group that's been meeting for several years now and been very involved in all aspects of developing the model, including the selection of the space, including the interior design, including the hiring of the staff and the other people that are involved in the alcove center experience. So the youth involvement is critical, and the youth are also the people that go out and market the program to other young people to help them understand it's a safe and comfortable place to be able to get the support they need. The alcove brand has been a critical piece of this as well. And so what you see when you look at an alcove center is a common look and common feel so that young people get a sense of what an alcove center has, and whether they're going to alcove San Mateo or alcove Palo Alto or alcove Beach Cities or the other new ones that are developing, they will have a sense of familiarity when they walk into an alcove center. They will have a sense of the common services. they will know at the core there's a youth advisory group that's been very involved, that's made up of the diversity of that local community to help them ensure that their Alcove Center meets the needs of their local community as well. As was mentioned before, the first several Alcove Centers opened up in June of 2021. Alcove Beach Cities opened up in November of 22, so they've been open almost a year. And will be very excited when Anna and the team open Alcove San Mateo sometime this winter. And it's going to be a wonderful opening, and hopefully we will see many of you there, and their team will be able to share the wonderful plans they've put together, and their youth advisors who have been so integral will be able to introduce their center to all of you as well. Right now, this network is continuing to grow, and our team at Stanford and our Center for Youth Mental Health and Wellbeing are the technical assistance partners for rolling out, all of these centers across the state as well. So right now, after we see San Mateo Center open, we're partnering with University of California at Irvine and Sacramento, and we're very excited to know that, next week the state will be naming 5 to 7 additional Alcove centers that will be receiving funding from the state to also get involved in starting this model as well. And we'll be excited to partner with them. And we're excited that Alcove San Mateo and the other centers will be guides for these new centers as they get started with this important process as well. One of the things I just wanted to quickly shift to and mention as another resource is a program that actually was started by some of the youth advisors who graduated from their Alcove work. They felt it was really important to address issues of social media and youth mental health in relation to that. And as a result, they put together a peer-to-peer program called Good for Media, which is really focused on the idea of how young people support other young people in using social media in ways that are safe and healthy for them. So I just wanted to share with you a couple of the things about that model, because for you as a parent or for your family members and children, Good for Media might be a great resource for all of you. Good for Media asks young people these core questions in terms of the role you think media plays in your mental health. Many of them are asking themselves and then putting on video, what advice would you give your younger self or a younger sibling getting their first phone about how to use social media safely? How do you protect your mental health when you're engaging with social media? And then how would you keep it safe and those platforms safe for other young people? These are some of the areas that, our Good for Media partners focus on in terms of addressing these issues. And you can go to their Instagram site or their website and see their resources that they've developed around these. Here's an example of some of the resources, and I'm going to talk just briefly about the guide for parents, because for you all and for me as parents, getting guidance from young people about how to support your kids around using social media safely and effectively is really critical. And the youth involved here have done an amazing job putting that resource together. They've also developed guides on how do you read the news in a way that can be safe and comfortable for you as a young person? And how do you address social comparison when you see that on social media so that you can continue to feel comfortable about yourself in every way while looking at and moving from website to website as well? A couple of examples from what parents need to know in the guide for social media, some suggestions around, instead of saying it's rotting your brain, you can try, suggesting to scroll mindfully and sit with your child with their phone and think through some ways that might be more comfortable for them. Or, finding other ways of talking about structuring time to spend with friends or other ways, instead of finding ways to just really say negative things about social media use, or really rather than trying to block it altogether. So I just include these as some examples that you can see that are from their guide, so that you might be able to take a look at that and get some really helpful guidance on how to talk with young persons around addressing their phone use in ways that might really be comfortable for you as well. You know, the young people we're working with at Good for Media are continuing to build the number of teen voices that are involved in this effort. They're starting to work now on a train the trainers model, as they've had a chance to present at the state school mental health conference and on other national conferences as well. They're being asked more and more to share their model. So they're now developing a train the trainers framework and a suite of educational supports as well. They're also looking at how to develop a guide for parents in terms of how to work with other parents on this issue more effectively and be an adult ally in a positive way. In addition, you know, they're really trying to grow the peer mentorship network of Good for Media broadly. Right now, there are young people involved leading this effort from across the country and even some international partners as well. They're trying to create more of a speakers bureau and then continue to work on different topic areas to be able to share with young people and families. And as I close, I just want to remind those of you in San Mateo County that right now, you know, there's a very active effort and a partnership with the County Office of Education and the leadership from County Behavioral Health to really look at the services for our young people in schools and build out a more solid network to be able to provide more effective support around school mental health and stronger ways to reach the needs of all of our young people. You know, this project really is based on a large effort to bring together multiple partners, and through the steering group that's involved with this effort, they've built out different work groups focusing on elementary school, middle school work groups, high school, as well as transition age youth, made up of school representatives, county representative, youth voices, parent voices, to really answer questions about how to ensure that the school mental health services that are happening around the county are supportive and effective for everyone. Here's just a sense of their timeline as they're going through these work groups, and right now several of them have been meeting, particularly the elementary and high school work groups. And then later in the year, the middle group and the one focusing on transition age youth will be meeting. And then the idea will be that this steering group will really put together this large group of recommendations and be able to run them by youth, parents, and others, and be able to sort of ensure that the services being delivered around school mental health are strong and effective. These are some of the colleagues that are sort of leading that effort through the county partnership. If this is of interest to any of you, to be able to learn more about it. In closing, I just want to remind us all that, you know, this is all about our young people, ensuring that they can get the early care they need. We know that early intervention works as well for mental health as any other medical issue, and it's critical we build these upstream supports for our young people as well. I want to just thank you for the chance to share this information with you and look forward to talking further with everybody in the next couple of minutes. So thank you again. Here's where you find me if I can be of help. Sarah Kremer, our implementation manager for Alcove, is also here tonight. Thank you, Sarah, for joining us as well. And we're really grateful for the chance to share this work with you. And we're excited to see Alcove San Mateo open in the very near future. So thanks.
Well, thank you, Dr. Joshi and Dr. Adelsheim, for that amazing discussion. You've given us so much to think about and so much to be hopeful about, and really wonderful resources. And we have really great questions coming in. So let's just get started. First of all, I want to say, you know, when I started this program, the Parent Education Series 18 years ago, we were trying to address the rising tide of student stress. And we thought we would get it knocked. And here we are. Do you think things are getting better, or are we just getting better at solving some of the issues? Steve, you're on mute.
I know, I was wondering if Shashank was going to speak.
I'll start.
Okay.
I'll start briefly and say, in some ways we are getting better. because I think more and more conversation is happening. Being able to talk about mental health, and again, mental health is part of overall health, and that we don't have to wait for there to be a crisis before we talk about it. We all need mental health. We need to be mentally healthy, physically healthy, spiritually healthy. Having a mental health condition does not depend on your mother's highest degree, of graduation, like we get in surveys. Mental health disorders do not discriminate. So having these conversations early and often, and having youth at the table guiding us, is really, I think, what's new and better. We are better as adults understanding what the needs of youth are, because we've done a much better job, I think, in the last 12 or 13 years. Unfortunately, it's taken some tragedy and some losses to really get our leaders to pay attention, and to get us to pay attention. But I do think some of the silver lining now is, like, ULCOV is a beautiful example of public academic engagement and partnerships, because these ideas started in communities around the world, and Steve and Vicki Harrison and their colleagues have been able to take that message. And you've seen this example in other countries. Steve mentioned Foundry in Canada, and there are a number of other countries that have adopted the Headspace model. I just love how the name itself, All for All of Us, and Cove, where we can go hang out and feel safe, was youth-led. It's for youth and by youth and about youth. So I think we are still going to have challenges. We are facing a lot of access issues, and being able to make sure our young people know about places like ULCOV is crucial. We still have a lot of work to do, but I think we're moving in the right direction. Steve?
So I would say a couple of things. One is, when we talk about issues for youth mental health, one of the pieces that people quote now frequently but don't really think about is, we're very good at talking about how half of all mental health issues have their onset by the age of 14. And yet, we have not prioritized creating the systems and support for that reality. Because when we think about what it really means that, these symptoms are starting so early in our lives, in children in every family's life, we would have a whole different world of mental health support, but for prioritizing our children, but for dealing with issues of stigma within our own families. And so, part of the importance now of school mental health services and the dollars going to it is sort of the first real recognition and acknowledgement that we really need to be prioritizing, as Shashank said, early intervention for this critical medical condition, and knowing how well it works. We need to grow it more. So, and having the dollars has been really important. I think one of the things that is a success is that we as adults and our families may not have gotten the message that mental health issues are in all of our families, but our kids have. And they've gotten it from each other, and they support each other. And you don't see the same degree of stigma in talking about mental health issues and challenges in our youth that we have ourselves. And I think that's a great strength. And I think more and more we are starting to see these initiatives of turning to our young people for their guidance around what they need and what works for them in a way that has never happened before. And for me, even as I was trained as a child psychiatrist, I was to listen a little bit, devise my diagnosis, and tell that young person and family what they needed and what they should do. And, that's not the way we work anymore. And now we work in a shared decision-making framework. We're partnering with young people and families. Here are your options. Maybe this is what you want to try first. And maybe this is the way you want to be operating around these issues. And it's a really different frame in terms of care. So I think that's another advance that I think is really important. But I have to say, we're really just beginning. And the advocacy for services for youth is not yet what it needs to be by any means. We have this short window of resource because of COVID. And, many of us are really concerned even in California, we have this great initiative right now, but the dollars go away in June of 2025. And what then? And how do we sustain this? And how do we build the ongoing support? So forgive me for going on a little bit about this, but we're in a better place. I'm worried about us keeping it if we have a long way to grow to really meet the needs of everybody.
Well, thank you both. I think a little more than a decade ago, when my daughter was in high school here at Menlo Atherton, if the kids wanted mental health help, they'd have to go across the parking lot into a trailer. And now look at these beautiful alcove centers. I was born and raised in Midtown Palo Alto. Every time I drive by that, I'm proud. That's a wonderful, wonderful thing that's happening. And then I look at programs like what April Torres is running in the San Mateo Union High School District. Unbelievable, reaching kids where they are. Okay, some really thoughtful questions coming in here from parents. Let's see how we can do. Here's a good one. What would be the best way forward when you suspect that your student is suffering from anxiety, but they can only recognize the physical manifestations, headache, stomachache, and they're very resistant to any kind of treatment via therapy? Very common question.
Well, I think it's a good question, because we know in that slide that my colleague Sarah Ordaz shared with us, you saw that character, I think who was intentionally drawn as, boy, girl, or gender nonconforming, who was dealing with not only one or two, but 3 or 4 different, and they were all physical, the symptoms. So in children, we often see this. In adults, we see it, right? But usually in adults, we can say, yeah, this is that feeling I get of nervousness, but actually it's going to be my superpower, because that just tells me I'm getting ready for the game. In children, they may not understand it, and it may be very uncomfortable. And in particular, they may not want to talk to anyone new. But where is the opportunity? The opportunity is with primary care. Primary care clinicians are the gatekeepers. So in many cases, if a child has a consistent person they've been working with since younger, in the doctor's office or with the nurse practitioner who's the primary care person, that can be a great place to start. And we know from some research that was done in our lab that was student-led, particularly among Asian diaspora youth, children of immigrants. And we know that in the US, 25% of our young people are immigrants themselves or children of immigrants. That number is more like 30 to 40%, depending on which part of the Bay Area you're in. And we know that for some of these kids in particular, boys in particular, in this study that our medical student did, they are less likely to go to their teachers or counselors in school, more likely to go to their doctors, may see it as a medical way out to talk about, I get really nervous, and they may open up to their doc. So that's a good opening for them. For girls, for those who are non-binary, they might actually feel more comfortable talking to peers, coming to an alcove center to connecting with the Trevor line online, or talking to a counselor, because many of these kids have been a little more, they have had some time relationally to mature. They may have talked about their feelings earlier on compared to boys, for example. So I think there are many opportunities there to get it started. We have to think outside the box when someone has no interest in going to a therapist. So I think about primary care. I think about school counselors as gatekeepers to help get the conversation going, particularly around physical symptoms of anxiety. Steve, anything you'd add?
Well, the one thing that I think has been really interesting is for a lot of young people that are going now to these, alcove centers that have opened, the peer support piece has been really critical. So I think having the opportunities to also connect with other young people that have had similar experiences, who might be able to have a whole different conversation with that young person around what might be happening, and maybe talk with them about their own experiences in terms of accessing care, and maybe learning what the concerns are for that young person, and helping them think through some of the strategies around dealing with these pieces can also be really, critical and helpful as well. So the peer support piece, or linking them to other young people who've gotten that support. And, Shashank has taught me and others around like the model sources of strength, right? Which is identifying those young people, right, who can take that on. who are the leaders within those school settings, who others will turn to, and giving them those skills has also been a really valuable strategy in some of those situations.
So thank you. This next is really kind of a comment, and I think it goes to what you've both been saying, Steve and Shashank, that along with all the promise of the alcove centers, we still are kind of at the beginning. So here's the comment. Finding support for young people, whatever that might look like, takes a lot of time and patience. How can parents, schools, and the care system acknowledge this and give them time in this hustle culture in Silicon Valley that sometimes seems counterproductive to healing our youth?
Well, time is the most elusive of all of the things that are precious to us. I do think that there are certain tools out there that you can find on the resources that we put around. Well, here's where your media and your phone could be really useful. There are now dozens of apps to help with things like stopping time, pausing, mindfulness activities for families, even something as simple as planning to have dinner 3 times a week. This is from Denise Pope's work at Stanford, right? The Challenge Success Group. They have a wonderful website. Some of you know about it, full of resources. And their research has shown around the country, cross-culturally, that things like modeling the slowing down, talking about your busy day and saying, I put my phone down when I come in because I want to see you guys and I expect you to do the same thing. This is a conversation we have with our kids, right? We learned in the 6 daily questions for quarantine, what version of normal am I getting rid of today or letting go of? And the idea that we would have no video games during the week. Well, Fortnite saved my boys' social lives because they stay connected. There's actually some research coming out showing that actually was very important for certain kinds of connections. But while we can acknowledge and embrace that, we know that there are other things just person to person that are so crucial for connection. And so for families in particular, I like to tell parents what I've learned around the struggle that we've had navigating the mental health system and learning about what it's like as parents. Like, the older they get, the busier they get. This person asked about Silicon Valley hustle culture. When they come into the house, you have the ability to slow down time. You might only have 3 or 4 moments with your teenager and about to emerge young adult. First thing in the morning when you wake them up, last thing before they go to school or you leave for work. That's number 2. First thing when you come home from work or they come home from school or their after school activity, and last thing before they go to bed. Even if you're not having dinner, but you've got 3 or 4 like time points, those moments, make the most of them. Those are in your control. That's when you can express unconditional love and listening and the kinds of things you want to impart, what they go to sleep with. Was it an argument? Was it a hug and I love you? These are certain little nuggets that we ought not to forget. Even as we get busier, these moments are still going to be available to us while the kids are in the house, because once they launch, it's much harder to do.
That's really beautiful, Dr. Joshi. Thank you for that. So we are coming to an end of our hour here, but Steve, there's questions about alcove. I just wanted to give you a minute or so to respond to some of these questions. I don't know if we know the address yet. I don't know if we know that San Mateo will be signing up youth advocates. And are the alcove centers a place where students can, here's Anna, may have that answer. And is it a place where kids can get help, or can they just hang out and feel safe?
Anna, you want to jump in here?
Yes, absolutely. I'll start off with the first 2 questions. The way that you can get involved with the YAG is through an application process that happens every year in April. I'm going to enter Jackie, who is our youth outreach specialist, email in the chat so everyone can have it on record and contact her around April when we start our recruitment process. As far as the location for Alcove San Mateo, we will be located at 2600 El Camino Real in San Mateo. We have open house dates available December 4th through 8th from 3 to 6 p.m. Our soft opening is January 8th. Our grand opening is February 3rd. And I'll also drop that information into the chat for everyone.
Thank you so much, Anna. And Dr. Adelsheim and Dr. Joshi, this has been a wonderful, wonderful program tonight. We feel just so honored to have had some time with both of you, and to April Torres from San Mateo Union High School District and Ana Polito from the Peninsula Healthcare District. Thank you for your sponsorship and for bringing this idea of this wonderful event to our community. So thank you, April and Anna and Steve and Shashank. We could not be more proud and happy. So thank you again to everybody who joined us tonight. We really appreciate all the wonderful comments and questions. Take care, everybody, and we hope to see you again soon. Good night.